Hi, welcome to Awaken Health Pod. I'm Jennifer Grogan, Integrative Health Coach with Greenleaf Wellness here in Central Illinois, and I am with Shanna Scordel, Integrative Health Coach with Inspire Wellness for You all the way in Arizona. How are you, Shanna?
I'm good. Just getting over this cold. Haven't had a cold like this in almost 5 years, actually.
Oh,
So,
wow.
been fun.
Got that vitamin C and D going?
Yes. Speaking of vitamin C and D, today we're going to talk about hair loss tips and hair growth health tips. And of course, we're going to come to you from vitamin and foods and fun fact perspectives. So thanks for joining in, and we're going to get started. Can you tell us some fun facts about the hair on our head and maybe our body, Jen?
Yeah. About 80 to 90% of the 150,000 hair follicles on your head are in the growing phase of hair growth. Isn't that kind of cool?
Yeah.
And we shed about 100 strands of hair a day.
Yeah.
So I know we're going to look at the nutrients, we're going to look at vitamins and supplements and stuff like that. So being that we are really in tune as health coaches to talk about food with our clients, I think it's really important to understand how our body needs to take in all the nutrients and the minerals it possibly can to establish proper hair growth. It's not just the growth, but it's like the strength of it and making sure that the scalp stays clean and stuff like that. So I know for me, when I was taking collagen, not only does it protect your gut, but it helps with the hair growth and the shine and strength and durability of it. So, nutrients we eat go into our bloodstream like everything else. And from there, the nutrients are delivered through the capillaries to the dermal papilla. I think I said that right. And it nourishes our hair growth. So you really want to be cautious of what you're eating. So like more vegetables, less processed foods, less sugars and stuff like that. So our hair and our nails are usually less to be concerned when taking in all that. But it's just really important to understand that just because it comes in last does not mean that you should lack on the nutrients and the vitamins and minerals out of our foods. So I thought that was kind of cool that we have that many that come out of our hair, like hair sheds every day of 100 strands.
And it grows about a half an inch per month. So 6 inches a year on average, which is pretty cool too.
Yeah, I just wished when they would fall out, it would be my silver ones. So that I'm not like looking in the mirror going, oh my gosh, I'm like pulling them out. So I probably have 200 a day that I lose just because I'm in there.
That's so funny.
So, but yeah.
Well, definitely poor nutrition and lacking nutrients is going to cause some symptoms regarding your hair. And so there's multiple reasons why there can be lacking of nutrition. It could be, like you mentioned, not getting enough of the right healthy vegetables and minerals and vitamins. But I'll go into this in a little bit more detail later. It can also have to do with your gut health and not absorbing your vitamins and absorbing your nutrition. So, of course, vitamins, they're found in foods, not just supplements, of course. And so, for example, eggs have protein and biotin. Biotin helps with the keratin in your hair. Eggs also have zinc and selenium. But the hair itself, it needs the proteins in the blood for really good hair growth and to prevent hair loss. So if you're lacking protein in your diet, or if your body isn't digesting protein, these could cause problems for hair thinning and hair loss as well. So a balanced and healthy diet typically isn't biotin deficient, but for people who have had rounds of antibiotics, and that kind of destroys the bacteria in the gut, then it's hard to produce biotin, which is really important for your hair. So, you'll want to reflect if you've had any surgeries, operations, major illnesses, if you've had frequent use of antibiotics, and if maybe you have really thick, luscious hair. I'm not sure if you do, send us a message. But typically, that's how the gut itself and the biotin will cause some hair loss. And so you need that balanced diet, but you also need to make sure you're absorbing your nutrients.
Mm-hmm. And then, like medications as well. So like thyroid disorders, lupus,
Mm-hmm. Yep.
scalp infections like ringworm. I mean, all that can contribute into, oh my gosh, I'm suddenly getting these patches and just different things. So, like sudden physical or emotional stress, um, extreme weight loss, if you've gone through childbirth, all of that plays factor on the hormones. And so you want to keep the balanced hormones as well, which I think is really important. And, men suffer from the gradual hair loss, and women are more prone for the sudden hair loss. So for women, it's common and caused by hormonal imbalances. So the pregnancy, menopause, poor nutrition, your stress and anxiety. So if you have children, you're going to have stress, maybe a little bit of anxiety. So, we've had people ask us, what do I do for my thinning hair? Well, the first thing that comes to my mind is, how's your thyroid? And so if you're on thyroid meds, just be, aware that that can cause some thinning or to lose some. So it's not something like freak out about if you're aware of what you're taking and what the side effects are. So then you can have more of an understanding of why it's happening.
Well, and you mentioned collagen, which is really good for the elasticity in our skin. It's also really important for artery health. And so vitamin C, among tons of other vitamins, is high in antioxidants, which help fight oxidative stress and free radicals. So free radicals within the body can cause cells to degenerate and mutate. And when you have those antioxidants, that's helpful to protecting, strengthening, and breakage in your hair as well, as long as they're getting to the hair follicles. So then low iron, maybe many of you have already heard how low iron could be linked to hair loss. Well, vitamin C helps with iron absorption. And from my understanding, iron is absorbed in the body, and then it's stored as ferritin, which is actually a protein. And so when we're low in iron, then the iron pulls the ferritin as well. And so many times this is seen in anemia and stuff like that. But so you want to eat your foods that are high in iron, especially, and get your iron levels checked. And your ferritin levels, which is a component of iron. It's just a little bit more elaborate testing, but it can be done very easily. And it's important to see the correlation there. And a lot of ferritin is stored in the hair follicle. So if your body is requiring more iron, it's taking the ferritin right out of the hair follicle. You're low on iron, you're low on ferritin, which is a protein. Your hair needs protein. So there's just so many weird ways that the functioning of the body interconnects, from exhaustion to hair thinning, both linked to, low in iron. So it's kind of interesting.
Yeah, when you can be more mindful what's going on with your stressors and stuff like that, it's amazing how you can connect the dots. So
Yeah.
I know the vitamin B complexes is really important as well. And then like for foods like the salmon, the nuts, the flax seeds and stuff. So those are really good.
Yeah. I think don't quote me, but I think I read that vitamin B and B12 deficiencies contribute to graying in the hair early onset. So I think there's some contradictory information on that, but I thought that was kind of interesting, And again, you can get your B12 levels checked through simple lab work. So it's, very handy and important. We always recommend getting your lab work at least annually, just to say for your own records and to kind of see where you're at, because your body does change and your microbiome changes and life changes, and the foods that you're eating during certain times of the year change. And all of this contributes to, really trying to maintain your optimal health and your optimum, vitamin levels.
Mm-hmm. Yeah, they all play in part. So like prescription drugs for your high blood pressure, depression, and stuff like that, arthritis, those have a way of lowering everything, the nutrients levels too. So you're going to get thinning in the balding. So
Yeah. And alternating, gut bacteria as well. So it seems like biotin deficiency seems to often be linked to celiac disease. And a lot of the times, if you're gluten intolerant, you could also have shifts in your hair, the thickness, the strength, and the growth. So that might be something to consider if you do know that you're gluten intolerant, or if you do the elimination diet to see if you improve by reducing certain things out of your diet to see if, it is promoting hair growth as well. And at a half an inch per month, you could probably notice pretty quickly when things are improving. I mean, faster than I think you'd imagine.
right. Yeah. I agree.
So vitamin A is even beneficial into hair growth. Beta carotene converts to vitamin A. That's obviously found in sweet potatoes pretty commonly. And there's iron very high in grass-fed beef liver. And you only need very small amounts of beef liver. It's really not something I've learned that you eat as an entree. You really eat it maybe as just a side, just like a small piece to supplement, or you could even ground it up with some of your meats or spaghetti just to kind of get that, fresh whole food vitamin in your diet.
Sounds good. There's also alopecia. People suffer from that as well. And that affects not just the hair on the head, but the whole entire body. So, if you notice differences going on throughout the lashes, the brows, and stuff like that, then, go to your doctor, because you could possibly have that. So, medications that cause hair loss, sorry, I've got notes right behind the screen here.
Well, that was really interesting. I'm glad you mentioned that. How do you say it?
Alopecia.
Oh, wow. Okay.
You've never heard of that?
I don't think so.
Yeah, it's the loss of hair throughout the body.
Yeah. And it's important that you mention that too, because it's not just hair loss that is a concern. I know you're very well-rounded in the area of PCOS, polycystic ovarian syndrome. So if you're gaining hair and you're growing hair in places you don't want, like your face, for example, that is a sign of, a shift as well, and some dysregulation going on as well, hormonally and gut related. And so if you're growing hair on your face, right, it's a huge sign for PCOS.
Yeah, skin patching and stuff like that. Yeah, it's very
Yeah.
uncomfortable. It plays a huge role in their body image for women with PCOS. There's medications you can take for the excess androgens in the body, which is the testosterone. So it kind of helps regulate the hair growth.
Isn't that interesting? Because a lack of estrogen can increase hair loss, but the androgen hormones you just mentioned, testosterone and DHEA, they help dictate hair growth.
Mm-hmm.
So that's pretty interesting as well.
Yeah, it's sad. It's frustrating for them. I've got polycystic ovarian, and I kind of cured myself with the eating and exercising, but I got the
Yay!
peach fuzz. The peach fuzz is very common, but it's what you do with it. So if you're going to go and shave it or wax it, and you're going to continuously do that, and I get that for the ones that really have it, because they'll start getting patches and they have to get treatments for that. So you can do, if it's real dark, bleach it out. If they're not real long, if it's real long and it's bothering you, then go, laser or something where you feel better.
And get health support. So you're getting to the root problem, not just the Band-Aid.
Right. So it's just really important to know what your levels are for your estrogens, testosterone, and stuff like that, and progesterone. But PCOS can be reversed through diet and exercise, and there's so many different levels of it, and it affects every woman that has it differently, and that's a whole nother topic for a podcast. But the hair issues do come in play, especially on the face, and there are things out there that you can do. There's a medication, actually, I know someone that's taken it to help regulate the hair growth on the face. So
Wow.
There's ways of doing it. So the
Yeah.
medications for that would be like heparin and warfarin and stuff like that. So
Yeah. Well, your estrogen, the adrenals have a huge role in processing your estrogen. Your liver has a huge role in metabolizing your hormones. And so, like you mentioned, there's some common times in our life when we're going to be more inclined to hair loss, thyroid imbalances, being a new mom, just giving birth, a menopausal woman. Those are some big times, where this is a symptom. But there's the regular day-to-day stuff where it's not getting your nutrients, stress, like you mentioned, or if your liver isn't, if you're not detoxifying your estrogen, then you build up estrogen dominance. So sometimes people can be confused with estrogen dominance, meaning you're making more estrogen or you have too much estrogen. Well, the reason why is mostly linked because you're not detoxifying the estrogen and getting rid of it. And I think in our last podcast on inflammation, we talked about just how, certain foods can bind to old estrogens and help detox them and get them out of your body. And so stress, you mentioned. So stress is so huge because it affects our adrenals. And if our adrenals are affected, our hormones are affected. If our hormones are imbalanced, it's going to, come in the areas of hair loss and hair thinning and brittle hair. And because the hormones aren't functioning, they're not communicating properly. And so that's kind of how, you can have low estrogen and then you can have estrogen imbalance, both playing a role in hair loss.
which fiber is really good for helping eliminate the extra estrogens in the body. So
Yeah.
PCOS, diabetes, stuff like that, you want to make sure you got enough fiber. And that's one of the areas I look at with my clients. What's your fiber intake? If we got too much built up, let's get it out. Let's get the fiber going. So
yeah. Do you have, for my clients, I kind of like to say, try to stay under 45 grams of label sugars a day. It seems high, but then again, where, people who aren't educated in that area can reduce so many sugars just by label reading and keeping under the 45. Do you have a specific amount of fiber that you recommend just for overall health?
not really. I mean, if they have an even protein, good sources of fats, and they're getting their adequate amount of, what they feel comfortable with for fiber, a lot of times they get it through their vegetables. So if they're eating enough vegetables, say they're getting 5 cups a day of vegetables and fruits, that's why I do the food logging. If you're lagging in your foods, and I can say, okay, well, where's your fiber at? Let's increase it a little bit. It's not so much saying you have to have 50 grams of fiber a day. It's just they should know by a certain amount of time how their body's responding with lacking in it and having a good amount to know this is where I should be.
Yeah, exactly. Fiber is so beneficial because that's your prebiotic. Right. Your prebiotic is not like a probiotic where it's a live bacteria. It's a fiber that needs the probiotic to be digested because it ferments in the gut, which is a good thing as long as you have a probiotic to go with it. And then, like you said, you're detoxing, you're eliminating in your bowels from having a good amount of fiber, which helps protect your colon, your bowels, to help prevent irritable bowel diseases. Balancing your gut bacteria. So all of those are hugely important.
Right. So, but no, I never tell them you have to have an X amount of anything because I want them to have freedom in what they're, how they're eating healthy, and by eating properly, the body responds. But the fiber does help the liver for detoxification. So you got to keep that liver clean, and you just feel better once you start eliminating. So
yeah, that's so important. I mean, there's essential oils that can balance hormones, detoxifying your liver. There's so many different things that can help properly, function and be running at a better optimal level.
Mhm.
Even insulin is a hormone, and so that has to do with hair growth, because if you're having an imbalance and a hormonal imbalance, then you're getting effects from that area as well, not just in estrogen, testosterone, DHEA that we mentioned, but insulin affects your fat storage, and depending on how you store fat, is linked to your hair follicles and your hair growth as well. So excess estrogen is stored in fat. And so if you're storing more fat than usual for various reasons, then this is, another red flag for hormonal signaling and imbalances there as well. So, being mindful of your sugar and your insulin levels, I think that plays key role as well.
Mhm. Definitely.
Um, some things to benefit hair growth, we're going to talk about in just a second, but I wanted to explore and expand on the area of the gut health. So we mentioned bacterias. Even dandruff is actually caused from an overgrowth of yeast. And so that's a bacterial overgrowth. And dandruff isn't necessarily dry skin either. It's actually from too much oils, believe it or not. And so sometimes people will put oil on the dandruff, and that's not good either. So there's just, just like your nails, your mouth can tell you a lot about your health, your hair can tell you a lot about your health. And so if we're having issues in our colon or colitis or irritable bowel syndrome, these are all in the realm of irritable bowel diseases, which is, there's gluten intolerance and SIBO and all kinds of things related there. But it's just really important because they play a huge role with affecting your hair. And irritable bowel disease is horrible and miserable, and it's something that you want to do your best to prevent. And if you are struggling with it, just know that you may not be absorbing your vitamins and your nutrients properly. And so it doesn't really matter at some points how many different types of food you eat or vitamins you supplement with, because you'll want to know if you're absorbing your vitamins and your minerals and being nourished and maintaining your nutrients. So you can do this through lab work. You want to make sure that you're not having chronic inflammation, bloating, weight gain, muscle loss. All of this is related to inflammation, which is related to irritable bowel disease. So eating like we always recommend, the anti-inflammatory diet, you're getting all of those beneficial vitamins to hair growth: vitamin C, vitamin E, magnesium, selenium, zinc, iron, vitamin A, biotin. So when you're eating these healthy whole foods, fruits and vegetables, healthy meats, wild caught fishes like the salmon with your omegas and your protein, then you're reducing your inflammation, you're improving your gut health, especially when you do, like you mentioned, the elimination diet, where you're reducing glutens and nuts and maybe things that could be irritating you. And so it takes a little bit of time and practice, but it may be hard at first because it's not convenient, but it's so important. You will feel better when you're improving your health. Mentally, you'll feel better. The sluggishness goes away. You may even have like awakenings just of life and energy and sleep. And why wouldn't you keep going when you're making improvements? And you'll know that your body and your skin and your hair and your nails and your bowels and right? I know I just kind of rambled a little bit.
Well, you got passion there. No, I agree. I think that if you can take out the things that cause the issues for the body, you will feel better. And it's not like a band-aid effect. It's a lifelong change, and it's the lasting benefit of it. But you were saying the oils and stuff, it's certain shampoos are going to create more grease and oils in the scalp. And so it's really important to have a really good shampoo. That's what hairstylists are for. So if you have issues, go ask them what they recommend, because they should know your hair and scalp just as well as you do, because you're the one that has it, but they're the one working with it. So
Yeah.
that's their expertise. But get a really good shampoo, because I don't know if that, does it sell some blue? Is that for dandruff?
I think
There's
so.
one of those as commercials, but anyways, like,
Rogaine, something, hair growth. Yeah.
probably to get rid of the dandruff. But just keep your scalp clean and talk to your hairstylist, which is really
Yeah.
important there. But yeah, I mean, you'll never know unless you dive in and experiment with what you're eating and your environment and just trying different things. And you will get hooked once you start realizing that, oh my gosh, this way of eating and changing my life around like this is just, awesome. So
Right.
it's just really important to one, to experiment with it and accept the change and continue from there.
Yeah, because you're dealing with hormonal balancing, stress management, liver and adrenal support, anti-inflammatory foods, moisturizing your hair through healthy shampoos, moisturizing your hair and skin through healthy foods, healthy vitamin absorption. So again, the hair requires amino acids, it requires protein. So, making sure you're getting adequate amounts of protein, and that with the irritable bowel issues that we talked about, that your dogs. With the irritable bowels, it contributes to, maybe not digesting protein. So it's not that you're lacking it, you're not digesting it, and it's not getting to your hair through the circulation. But one last topic that I really wanted to talk about as well, your stomach acid is really linked to hair growth as well. Low stomach acid can contribute to all kinds of things. It can contribute to poor gut health, overgrowth of the wrong bacterias, GERD and acid reflux, indigestion of proteins, and low amino acids. So some ways that you can increase your stomach acids, because we need gastric acids. Without them, we're unable to absorb, digest proteins and vitamins. They're very important. And so sometimes GERD is misconstrued as too much acid, and so it's coming back up. That's not it. It's actually a lack of stomach acid. And so increasing just with apple cider vinegar or hydrochloric acid is hugely important. Even with my own doctor, she's been helping me support my hydrochloric acid. And so that's been extremely helpful, and I love it. But chewing your food, I know we talk about this and we mention it all the time, but really taking your time to chew your bites and chew your food, because your enzymes and your digestion starts in your mouth. And so it goes, down all the way to your, large intestine. And so increasing your stomach acids just by having a little bit of apple cider vinegar before your meals, mixed with some water maybe, is beneficial to absorbing your vitamins and nutrients and growing your hair.
So we gave a lot of information that I hope that you guys can find very helpful. But a lot of it's hereditary, so
There's that factor.
yeah, just got to stick with it and try your best to manage. But there are ways to make it at least feel thicker, stuff like that. So.
Well, your hair looks beautiful. You look great. Well, thank you everybody for listening. We hope you learned something. I know some things are simple, like, iron and good shampoo and, healthy vegetables, but, just pay attention to those anti-inflammatories, reduce inflammation, always focus on gut health, make sure you're absorbing, eliminating, increasing your fiber, and send us pictures of your beautiful and sexy hair.
Until next time, stay healthy.